Welcome back to Great Day Medical Monday. If you're looking to upgrade your smile, have you thought about veneers? They are thinner and require less prep than ever before. We're back with the Texas Tooth Lady, Dr. Terri Alani, and she's here to explain the process and who these veneers are good for. Hi. All right, this is the result of technology, and in cosmetic dentistry, things have come a long way.
A long way. So before we used to have to reduce the teeth. Nowadays,
meaning grinding them down.
We don't use the word grind, okay? But
work at it.
Work at it. But now, through new technology, we have templates so that we do minimal tooth reduction. So basically, we don't even need to numb the patient up.
Yeah, all right. And Lumineers is what we're talking about.
Lumineers is a brand. Okay. DenMed is the only authorized lab in the United States that makes Lumineers. So not everyone is a certified Lumineer dentist. Now, there's other types of veneers too that are great as well. I happen to like Lumineers because they are so thin and yet so strong. So new technology allows them to fit seamlessly over the existing tooth with minimal preparation.
Now you say so thin, you mean as thin as
a contact lens. And this patient here, you can see how translucent they are. Now, if you're going to think about getting Lumineers, I would recommend usually doing 2, 4, or 8. We usually do 8 because patients want to widen their smile.
Yeah.
You don't ever do 6 because your eye teeth are the most prominent teeth in your mouth, and you will have just a shadowing behind them.
See, that is so crazy because I would have thought you would have to have done some reduction there and stuff.
No reduction, very minimal. Now, in this patient, her 2 front teeth are sticking out further, so we did have to do a little bit of minimal prep on those, but the other ones not so much. We also use laser. So we use the laser to recontour the gum to make the teeth longer.
Yeah.
So not necessarily do you have to lengthen the teeth, but usually you can get it by just adjusting the gum height. Same here, you can see the before and afters. So we get just some great results with Lumineers. It's a 2-appointment process.
And these things, like you said, they're so strong, they'll last for decades.
They can last up to 20 years or more. They are incredibly strong. It has to do with the way they lap over the edge of the tooth. And so basically the process is the patient comes in and we do a Lumi Smile. And the Lumi Smile is a picture before and after. This is my dog Piper. We just happened.
The eye teeth. Look
one
at that.
day, we do this on every patient. We were wondering if the lab was open that we send these to, and they were. And this is my dog, and this is before and after. And so every patient gets one of these so they can have a preview of what their teeth will look like.
Yeah. Look, Piper's like, I can no longer dig into a steak.
And she posed. So,
so but Piper is actually your dog that you actually use as a therapy dog.
Piper is actually my therapy dog in the office. She's there every day for the patients that have dental anxiety. She's fantastic. So the first appointment, we take impressions and then we send it to the lab, and the lab comes back with a preview, a wax up is what we call it, that we're able to tweak. And I think that there's a photo of the before and after. This is just the wax up. These are not the permanent veneers. This is what we think the case should look like. So then the patient comes in and we use a technology called ART. It's very simple. This is the video. So we have templates. The lab makes the templates and tells us exactly where to prepare. You can see this is minimal. We're not going through the enamel at all. And I call it Lumineer by number. Here you're putting in the temporary material. So after you do the minimal prep, the temporaries are placed in to look exactly like the wax up that you just saw.
Right.
We place that in, take it out, and there are your temporaries, and you're able to wear those. It's a trial smile.
That's really cool.
So it's predictable, so there's no guesswork into what your veneers will look like, and you're able to tweak them. If you want a tooth that's longer, if you want something to reshape, we can do that in the chair, and then we finalize it by sending it to the lab, and you get your after.
So then the third appointment,
you're seating in the case. So it's basically you have the before, then we take the impression, you have your trial smile, which are your temporaries you wear for 2 weeks. This shade guide is amazing. The shade guide on the left is, if they can go back to it, I don't know. The shade guide on the left, that was our shade guide for years.
Yeah.
That's what we picked with veneers. Look at the shade guide on the right. It's so many shades
because people want white teeth.
Everybody wants white teeth.
Don't give me, I'll have natural looking teeth. It's kind of like the eyelash lady. Would you like a natural? No, I don't want a natural. I'm not paying you for natural.
No. Everybody, and I want white teeth. I mean, you want white teeth. So with these veneers, even though they're minimal prep, you can get an amazing shade. They're bonded in at the final appointment, and you just get incredible results.
Let me start
with
this.
It's painless.
It's like when people come in, you want them to have good oral hygiene, good teeth to begin with. So when you go through the process, go in and even go to you just to get your teeth, like your your maintenance every 6 months.
And not everyone's for minimal prep. So minimal prep, you just can have small chips. If your teeth are totally misaligned, then you'll probably need to go into Invisalign or a little bit more
But you can get 'em there.
preparation. Absolutely. But the mental preps, I mean, everyone comes in for Lumineers now. It's really exciting. It's an exciting time for dentistry.
All right.
Less
I like
invasive is better.
And they stay white pretty much, right?
No, they do not stain.
Oh,
They do not stain.
Look at
Veneers
that.
do not stain. You got white teeth,
Okay,
Deborah.